This is Sandy Tankus for TOS50.com, the other side of 50. And I'm here today with Dr. Jean Yang in Mineola. And Dr. Yang is an ophthalmologist. Good afternoon, Dr. Yang.
Good afternoon.
And how are you today?
Good, very good.
And Dr. Yang is going to speak to us today about eye problems that we have to be concerned about as seniors, baby boomers or seniors. And let's say that the things that I'm really familiar with, Dr. Yang, are things like cataracts, which so many of us have, or dry eyes, macro degeneration. So why don't I start off by asking you, what about cataracts, you know?
Yeah, those are, what you mentioned, those are common eye diseases. Cataract is very common. A lot of people, it's very common. Actually, almost everybody gets, a certain degree of cataract at some point, but not all are, visually significant. It's only when it's visually significant that you need cataract surgery to remove it.
And at what age do we have to begin concerning ourselves about cataracts?
It really varies from individual to individual, but I would say in general, 60, 65, after that age, the incidence rate goes up.
Well, that's the age of the people on our website.
Right.
And dry eyes, which is...
Yeah, dry eye is a very, very common problem. It's especially more common in women, and hormonal changes can affect it. So it's even more of a problem among postmenopausal women. It can be very uncomfortable, and the symptoms are highly variable. So sometimes you may not even know that the symptoms you're having are dry eye symptoms. It can be painful. Your eyes may have foreign body sensation, or some people just complain that it's a dull ache, or their eyes feel heavy or tired. The symptoms can be, very variable.
And what do you do for dry eyes?
We usually start with something benign, like artificial tear. And those are over-the-counter drops, artificial tears. There are many brands. And for a lot of people, that's enough. And if you use it, 2, 3, 4 times a day, and you still feel uncomfortable, then you need stronger treatment. So we do have other stronger treatments, such as a prescription drug, Restasis. Many of you may have heard it on TV commercials. It's a very good drug for dry eye treatment. And we also have other treatments, such as Ponto plugs.
Plugs.
Right, to slow down the tear drainage. It's a very small office procedure, very benign, non-invasive, that we do in the office. It's a very good treatment.
Yeah. And what about macro degeneration? Because people go blind from macro degeneration.
Right.
What age does that start?
Again, it's variable, but I would say in general, again, 65, around age 65, that you need to be checked. I would say it's always a good idea to have annual eye checkup. And this used to be a very difficult disease to treat, but fortunately, nowadays we have more and more treatment options. There are more and more medications we can use to slow down or even prevent the progression of the disease.
Is that right? Is that... Now, I know there's wet macular degeneration and
Right.
dry macular. What is the difference between them?
Well, the dry type, in general, there are always exceptions. In general, is less devastating in terms of vision loss. The wet type is when there are abnormal blood vessels forming at the back of the eye, and because they're abnormal vessels, they tend to bleed. And when they bleed, it's therefore the wet type, so it can be very visually devastating.
Have they come up with anything to help with the wet type then?
Yes, there are more and more medications available. Many are injections, that you receive periodically. So there's not a miracle cure yet, but there are more and more treatment options that we can slow down the disease process.
So it's on the way, in other words.
Hopefully, yeah, and in some cases we can even stop the disease progress. Yeah.
That's great.
Mm-hmm.
And have I left anything out of the diseases or the issues?
Yeah,
that,
glaucoma is another very serious and not uncommon eye disease that affects approximately 1% of individuals over age 65. And this is a silent disease. By the time that the individual is symptomatic or is aware there might be a problem, it's oftentimes quite late. So this is one disease we have very good treatment for if it's caught early, and it's one of the important reasons that everybody needs an annual checkup, because you may not be symptomatic, you may not be aware that you have glaucoma.
And is there any special care that people can give to their eyes, sort of like if you brush your teeth every day, may not get cavities. Is there anything like that you can do to protect your eyes from some of these diseases?
Well, a lot of the disease, I would say in general, a healthy lifestyle, healthy diet, exercise can be very helpful. And probably the most important thing is annual checkup.
Well, thank you very much, Dr. Yang.
Thank you.